Hey everybody, Dr. Goodman, the orthodontist. This video is meant for patients who have had braces or Invisalign in the past, who have retainers that maybe they wore in the past really well, but now find that the retainer that they have does not fit in the mouth. Now, quite often when this is the situation, a patient will still feel like their teeth look pretty good. If you're a teenager, maybe your smile looks great. You don't want to tell your parents. You get compliments on your smile, but your retainer doesn't fit. The reason why your smile can look nice and the retainer cannot fit is because your teeth could have regressed slightly from that ideal final result. Now, if it stops at that point, you're going to be fine. And that can be the case, but it's usually not. Usually what happens is the teeth will gradually get worse and worse and worse. But it's such a slow pace that nobody notices it. Your parents won't notice it, and you won't notice it until it gets to a critical point, and then it's too late. How do I know this? Because I've seen this happen for 30 years. This video is also meant for adults who might be in the same position. And sometimes patients can be hard on themselves where they're embarrassed, they don't want to go back, and they rationalize and they say, my teeth still look fine. You know what? I don't even care. But you will care. I think I can think of 3 people in the last month that have come back to me. It used to be COVID that got blamed. A woman told me that her mom was not well and it was not important to her anymore. And I totally get that. There are more important things than perfectly aligned teeth. But now it is important to her because now she's looking at it one day and it got worse and she's sort of frustrated. So here's what you've got to do. If you have the retainer that doesn't fit, do not try to put it on your teeth unless it snaps in all the way despite being tight. I'm talking about retainers that only go halfway up. Don't listen to advice you may get online that talks about trying to jam it in, take Tylenol, and then see if that can get your teeth straight. If you are a former patient, an adult especially, don't call your orthodontist and ask them to mail you a retainer from 3 years ago to try to get a quick fix. That's not going to work. It's going to stretch the ligaments that hold your teeth in place, and it's going to give a very temporary kind of fix where you wake up in the morning, your teeth may look better. Maybe that space that opened will now close. It's going to bounce immediately back. I use kind of the crude analogy that I have jeans that I wore like 20 years ago or shirts, and I put it on. I'm like, oh yeah, this fits. It still fits. It doesn't fit. And the minute you take it off, boing, pardon that crude visual, but it's the same kind of thing. You need to go back to the orthodontist and get a new retainer that will not change anything, but will fit perfectly. And this way you will not have any further regression. You got to cut your losses, and that's okay. But a lot of people don't want to do that. The reason this message has to get out there is that there needs to be a middle ground between wearing your retainer every night and being perfect without fail, or never wearing your retainer and your teeth go all the way back. And the middle ground is sometimes accept that maybe your teeth are not as good as they were at the end of the treatment, but you don't want it to get any worse, so get a new retainer. Thanks for paying attention. One take. My videos are always one take, and I excuse any mistakes I might have made. Take care.